International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
Correcting India's chronic shortage of drug inspectors to ensure the production and distribution of safe, high-quality medicines. This paper results from the study undertaken as a part of large project accessing medicines in Africa and South Asia, funded by the European Union 7th Framework Program. AMASA project was conducted in Uganda, South Africa and India. In the context of AMASA project, we selected 4 districts, Dhule, Sangli, Nagpur and Mumbai city, thereby considering the diverse areas of north, south, east and west zones of Maharashtra. If you see regulatory structure in India, state authorities, that is state FDAs, they are primarily responsible for the regulation of manufacture, sale and distribution of drugs. The Central Drug Standard Control Organization CDSCO is responsible for approval of new drugs, clinical trials in the country, control over the quality of imported drugs, and coordination of the activities of state FDAs. In each state, drug inspectors are responsible for inspection of manufacturing, distribution and sales units. Additionally, they are also responsible for taking drug samples for testing, conducting raids, taking action against non-compliance, following up with legal actions, recalling non-compliant drugs, enforcing drug price control orders, and regulating drug advertising and drug promotion. For more than 4 decades, national committees have highlighted the shortage of drug inspectors in India. Part of the problem lies in the division of powers and responsibilities between states and the national government. This text box summarizes the key reports and findings of government committees over the last 4 decades in respect of inadequate testing facilities and shortage of drug inspectors. The 1975 Hathi Committee drew attention to the shortage of inspectors, a position which had changed little by 2003. The Marshall Committee in 2003 reported that the growth in the number of inspectors had not kept the pace with the growth of the industry. At that time, there were only 935 inspectors nationwide. The Marshall Committee estimated that 1720 drug inspectors were needed. By 2012, the 59th Parliamentary Standing Committee estimated a need for 3,200 drug inspectors, many more than the 1,349 sanction posts, and seriously problematic in as much as only 846 of the sanction posts were actually filled. The government has implemented the recommendations of these and other committees only to a limited extent. The Working Group on Drugs and Food Regulation for the 12th 5-year plan 2012 to 2017 have proposed achieving compliance with the Marshall Committee recommendations by the end of the plan period. Global and national norms for the frequency of drug inspections and the strength of the drug inspector workforce were tabulated for comparison with Indian norms based on the Drugs and Cosmetic Act and rules. Compared with recommendations of the global agencies, Indian norms require more frequent inspections, that is, not less than once a year. There are no clear workforce planning norms in the Act. The Marshall Committee recommended 1 drug inspector for 50 manufacturing units or 200 sales units. According to the Maharashtra State FDA officials and the State FDA Annual Action Plan Report 2009-10, a drug inspector must inspect 10 manufacturing units per month or 21 distribution or sales units per month. There is no information available to explain how the workforce planning norm of the Maharashtra State FDA was derived. Although these are not clear workforce planning norms, but can be used to estimate the number of drug inspectors required to inspect all manufacturing, distribution, and sales units in the state at least once a year. This table shows the number of manufacturing and sales units, the number of expected and actual inspections, the expected, actual, and sanctioned number of drug inspectors with reference to these two norms. In 2009-10, Maharashtra had 78% and 83% of shortfall of drug inspectors in field posts based on the Maharashtra FDA and Maharashtra Committee norms respectively. Additionally, only 45% of sanctioned posts were actually filled. In 2009-10, only 23% of the required inspections were actually conducted in Maharashtra, whereas in the study districts it was 24% in Nagpur and 11% in Dhule and Sangli. This is the first study to identify the magnitude and examine the reasons for the shortfall of drug inspectors in the state of Maharashtra and in selected districts. Maharashtra has struggled to recruit the sanctioned 161 posts of drug inspectors. Though availability of skilled human resource was not perceived as a major problem in Maharashtra, delay in recruitment, court challenges, a slow recruitment process, and lack of career opportunities were described as reasons for the continuing failure to reach the desired standards. Section 21 of Drugs and Cosmetic Act 1940 indicates that the central government and state government have the power but not the duty to appoint drug inspectors. Inspection norms, however, are not indicated separately in the Act or in the rules. They are only mentioned under the duties of drug inspectors in Rule 51 and 52. Additionally, both the Act and the rules lack workforce planning norms for estimating the required number of drug inspectors. Despite the long list of job responsibilities of drug inspectors, both the state and central governments are now expanding the role and increasing the workload of drug inspectors. For example, in addition to their current tasks, the CDSU has proposed that drug inspectors will also inspect clinical trial sites once a year. Maharashtra has expanded lab testing capacity, which will further add to inspectors' workload. They will receive reports more quickly and they will be expected to follow up on more samples. We recommend that the Government of India should constitute a committee with a clear process and timeline to develop workforce planning norms based on the recommendations of the Maharashtra Committee and global standards. The committee should also consider whether primary legislation, that is the Act, and the secondary legislation, that is the rules, require any change or not. This committee should assess the implementation status of recommendations by various other committees in the past.